Is it possible for a 45 years and above old woman to get pregnant? In this video, we'd like to look at how a woman who is 45 years and above can get pregnant. We'd like to look at the diminished ovarian reserve, a woman with diminished ovarian reserve, how can they get pregnant? And also, we'd like to look at the most fertile age for a woman to get pregnant. Don't miss.
Ask Dr. Uthuman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Uthuman YouTube channel for yet another amazing episode of Ask Dr. Uthuman, where we are going to look at the problems affecting you, my viewers. If you'd like to get in touch with me to have a private chat, a private conversation besides the Facebook, the YouTube and the TikTok where we always interact, please go to my website www.druthman.com. Book an appointment. We shall be able to interact. I'll be answering your questions. Sorry for those that have been making appointments for the past 1 year. I've been off. I had some issues and everyone I think knows about that. But right now, all my sites and websites are active. They have been restored. So you can go there, book an appointment. I'll be right there to answer you. You can follow me on all our social media platforms. The name is Ask Dr. Uthuman. Today we are looking at a very sensitive topic. I have several people that asked questions about this topic we are going to talk about, and that is the ovarian reserve and also conceiving at 45 years and above. There are several people who have been asking these questions, but I'm going to mention a few here. Number one, this is Red Gold Colors. She said, "Hey doctor, can you please talk about low ovarian reserve?" Then another one said, "Hello doctor, I've been trying to conceive again after 4 years in vain. My cycle became irregular all of a sudden from 28 to 30 times." I think there's a mistake, 30 times, 35, something like that. What could be the problem? Could I be having an STI, or could it be due to my age because I am 42 years old? Please help me. Another one is called Quinta Gomez. She says, "Hi doc, I am 45 but still menstruating." This is very good. She's menstruating. "I got 3 children. My last one is almost 12 years. Can you imagine? Though my husband traveled but came last February and spent almost 3 months, but I am not able to conceive. Sometimes I'll have hope as my cycle changes, sometimes almost 2 weeks after the expected date, but later it come out. What advice would you give me because I am..." So this woman is 45 years, the other one is 42 years, and they are worried at 45, can they conceive? Now, as I answer this question, I would like to combine 2 things, and I want everyone to be attentive. Please first relax, take a glass of water, and get attentive, because there is a lot of science which I would like to really simplify for everyone to understand. Now, when we are talking about ovarian reserve, what they call diminished ovarian reserve, talking about age 42 and 45 to conceive, we must understand this. Number one, what is the reproductive age of a woman? What do we call the reproductive age? The World Health Organization defines reproductive age, or science defines reproductive age as the age at which a girl gets menarche. Menarche is when a girl starts menstruation. The first time a woman sees her periods is called menarche. And now that reproductive age ends at the time when there is menopause, when the woman is no longer having menstruation. That is what we call the reproductive age, the woman's reproductive age. Now, we've seen that it is between menarche and menopause. Let's simplify it in simple terms. We look at the age. Age is usually between 9 years and 55 years. Because according to the WHO standard, they say that menopause begins from 45 to 55 years. Some women get their menopause at 45, but others in between, they're up the period of 55 years. So according to the WHO, the World Health Organization, by 55 years, every woman should have stopped menstruation. However, we've seen women that begin menopause early. We call it early menopause. You find a woman as early as 30, they are getting menopause. 32 years, they are getting menopause. And of course, there are reasons, there are many causes of that. But of course, the main cause, of menopause is the loss of ovarian function and decreased levels of estrogen. The moment there are low levels of estrogen, or what we call estradiol, if estrogen levels get down, if they decrease, you just know that someone is going to have menopause. If there is loss of ovarian function, you're going to have menopause. So, and again, this is when I'm going to answer this question. When is the peak? At what age is a woman most fertile? Now, you understand that. In the late teens, when a girl is around 18, 19, that late period, the late teens, a woman is very fertile. And that period is between the late teens and then the late 20s or the early 30s. So the most reproductive period becomes 19 to 29 years. That time, a woman is very fertile. And I guess whoever is watching this can understand when not to mess up. So that period is very dangerous. Most women will conceive. It is the most reproductive. That's the period a woman is more reproductive than any other time. So now, I want you to be very attentive, colleagues. The question is, someone is 45 years of age. Will they be able to conceive? And another question is, if someone has a diminished ovarian reserve, are they able to conceive? So I want us to combine this. Combine this. Please, I want you to become here. I want you to understand this. Now, how does age affect the ovarian function? How does the age, someone's age, the age of a woman, how does the age affect the ovarian function? Because we've seen that the causes of menopause, the main reason as to why menopause happens is because there is loss of ovarian function. There is decrease in estrogen levels. So how does age cause this? Now, understand this. A girl is born with up to around 1.2 million eggs in the ovary. When a girl is born, today, that girl, every baby girl is having between 1 and 2 million eggs in the ovary. Now, I want you to understand that these eggs will never increase in number. But instead, they will decrease. Actually, the eggs will decrease by 10,000 eggs every month. In other words, before puberty, before a girl undergoes menstruation, the eggs will decrease by 10,000 every month. What do I mean? A child is born today. At 1 month, eggs which have been 2 million will decrease by 10,000. At 2 months, they will decrease by 2,000, like that, up to the age of puberty. And by puberty, this girl that had around 1 to 2 million ova is now having between 300 to 400,000. I don't know if you're getting me. You're seeing how age affects ovarian reserve or the ovarian function. Born with 1 million or 2 millions, by puberty, by the time a girl is menstruating, they are left with around 300,000 ova. And these ova are going to decrease by 1,000 every month. Every time you see your menstruation, every month, the ova, the eggs, the number of eggs in your ovary are going to decrease by 1,000. We said before puberty, they are decreasing by 10,000. After puberty, they are decreasing by 1,000. Now, as the age goes up, the number of eggs lower down. We started with 2 millions. You may reach the age of 30 when you're about 4,000 eggs. the eggs are decreasing by the age. So as the age advances, number of eggs decrease, and the functionality or the functioning of this ovary and those ova also reduce. So there is diminishing functionality of the ova and the ovary. Actually, why is also the functionality diminishing? Why is the functionality also decreasing? It's because as you advance in age, you're prone to different diseases. Women tend to get fibroids. They tend to get endometriosis. And actually, when you get these diseases, when you get endometriosis, you tend to decrease the number of these eggs. You tend to decrease the functionality. I don't know if you guys are understanding me. There's been a lot of science there, but just to know that as the age advances, you decrease the number of eggs. You decrease the number of eggs in your ovary. So someone who asked that at 45 years, can I conceive? I think you're now trying to get the answer, slowly by slowly. Now, what is low ovarian reserve? Low ovarian reserve simply means that your ovarian potential has gone down in terms of the quantity and the quality. By low ovarian reserve, we mean that the number of eggs in your ovaries has gone down, plus also the functionality, the vigor, the health of your of your eggs has also diminished. And that is what we shall call the low ovarian reserve or diminished ovarian reserve. How will you know that you have diminished ovarian reserve? Because someone may be there, they are not able to conceive, and they don't know that they have diminished ovarian reserve. Actually, most of these people, they are symptomatic. They may not know that they have diminished ovarian reserves. But one of the signs that will try to trigger your mind that probably my ovarian reserve is going down is the shortening of your menstrual cycle. Someone had their periods, the length of their menstrual cycle was 28 days. And as time goes by, they find that they are having 25. After more 2 years, they're having 20. The length of their menstrual cycle is going down. It should click into your mind that probably you have low ovarian reserve. Now that will call for investigations, which we are going to see. But what can cause? Because yes, I want to bring you back. We saw that what is leading to menopause is low levels of progesterone, and also we have the ovary. The ovarian reserve has gone down. Now, what is causing the low ovarian reserve? The diminished ovarian reserve? One of them is smoking. I don't know. Women love smoking. And these days, you guys love shisha. Shisha is smoking. And I want you to understand that smoking is one of the habits, is one of the causative agents of diminished ovarian reserve. That nicotine, the nicotine that is found in smokes, in tar, that nicotine can cause diminished ovarian reserve. Also, when you look at, there are some women that have genetic abnormalities, the genetic disorders, like Fragile X. Actually, children or women that are born with Fragile X are at a high risk of getting diminished ovarian reserve. So once it is identified that you have this Fragile X, which is a genetic abnormality, it is a congenital abnormality. If you identify that you have it, then you need to see a genetic doctors to also try and find out how you can get some treatment. Now, when someone is using radiotherapy or chemotherapy, I think you understand which people use radiotherapies and chemotherapies. People with cancers, there are stages of cancers where a doctor tells you you're now going to start chemo or radiotherapy, and when you're undergoing such treatment, actually those rays and the medicines that are used for chemo and radiotherapy can actually cause diminished ovarian reserve, or they can cause low ovarian reserve. Also, There are women who have undergone surgeries, especially ovarian surgeries. Someone was found with either ovarian cancer, or you are found with an ovarian cyst or anything, and you've had a surgery. These women are at a higher risk of having low ovarian reserve, because some of them actually end up losing some of the ova, or even losing part of the ovary, so they will end up with ovarian low or diminished ovarian reserve. Then women who have endometriosis, some diseases like endometriosis. Endometriosis will actually, I think in one of my videos I talked about endometriosis and looked at its effects. If you want to understand what endometriosis and how it can cause infertility, you got one of my videos. I talked about endometriosis. Now, if someone has endometriosis, this endometriosis can lead to a low or diminished ovarian reserve. Now, which investigations can be done? Because we've understood that one, it may be asymptomatic. You may not know that you have low ovarian reserve or diminished ovarian reserve. And we said that the only sign that may come up is shortening of your menstrual cycle, the length of your menstrual cycle. So how will you know? Especially if you're a woman and you see that you're taking long to conceive. You're taking long to conceive. 1 year, 2 years, 3 years, you're not conceiving, you're not using any protection. Then think about this. Now what will you do? You will do investigations, do tests. The first test I want you to understand is the intravaginal ultrasound scan. What will this intravaginal ultrasound scan do? Actually, when we are using this intravaginal ultrasound scan, it can be able to manually count, physically count the number of eggs in your ova. They can count the number of eggs in your ova. And with that, you will understand that the number of eggs in my ovary are reduced or they are normal. You can also do a fertility hormonal assay. Fertility hormonal assay, I've always talked about this test. The fertility hormonal assay. There are a lot of hormones that aid a woman to conceive, that aid a woman to get pregnant, that aid a woman to during delivery, that aid a woman to get breast milk, and so on. There are a lot of hormones there. But when you want to test to find out whether you have low or normal ovarian function, you can do FSH, follicle stimulating hormone, the estradiol, and AMH. AMH is anti-mullane hormone. Now, if you do a test, if you do a lab test, because they'll take off your blood and look at the levels of the follicle stimulating hormone. If the levels of FSH, the follicle stimulating hormones, if the levels are down, just know that the ovary is not functioning well. If the FSH, the follicle stimulating hormone levels are down, just know that the ovary is not functioning well, and that should indicate diminished ovarian reserve. Also, plus this, the AMH, anti-mullane hormone. You found that there is diminished or low levels of FSH. You found that there is increased, there is reduced AMH, anti-mullane hormone. It will also indicate low ovarian reserve. Actually, if you find normal or increased anti-mullane hormone, AMH, you know that there is normal functioning of the ovary. The ovarian reserve is okay. But if it is reduced AMH, just know that there is low ovarian reserve. Now, what about the estradiol? Because with testing the ovarian reserve functions, we look at 3 hormones. The AMH, we look at the FSH, and then the estradiol. So now, if you find that the levels of estrogen are increased, estrogen levels are increased, just know that there is poor ovarian reserve, because high levels of estrogen will decrease the follicle stimulating hormone and also will decrease the ovarian reserve. Now that you've already identified that you have low ovarian reserve, or what we call diminished ovarian reserves, how are we going to treat this? Now, I want you to be very attentive, colleagues. I want you to be very attentive here. We are going to look at a woman who has diminished ovarian function or ovarian reserve. We are also looking at a woman who is 45 years and above, or who is no longer having their menstruation, or whose menstruation is becoming irregular, whose menstruation is becoming a problem. Someone had 30 days, and right now they're having 15 days. So we are combining this. What are we going to do? Number one, which is the most important, and this is what I want to understand, and this is what I usually do to these people. Number one is ovarian hyperovulation or ovarian superovulation. Most people call it ovulation induction. We are going to induce ovulation by giving you medicines. And the medicines which we are going to give you are going to help us, number one, cause stimulation of your ova, of your eggs. They are going to cause stimulation of your eggs so that the eggs can be ready to be fertilized. Now, these medicines include the Menopa. This is an injection, a very wonderful injection. We have injections like Metrodin, Pagonal, Riplonex. All these injections can be given to cause ovarian superovulation. Also, we can use a hormone called human chorionic gonadotropin. What hormone is this? Actually, I think most of you, when you get pregnant, you go when you go for a test, a pregnancy test, you buy that strip. It's called HSG strip, human chorionic gonadotropin hormone. It's a hormone. So that hormone can be detected in urine. It is also found actually in blood. That is its first site. It is found in blood, but can also be detected in urine at the period of 10 to 14 days after conception or after fertilization. Now, that hormone can be used because we know that HSG, I am meaning that hormone, the human chorionic gonadotropin, is responsible for the final maturation, of the ovum. The final maturation of the ovum is contributed by the HSG hormone, and therefore, if this woman is having diminished ovarian function, diminished ovarian reserve, we can give those injections, and they include the prophylaxis and Ovidrel of this world. So those hormones can be used to cause ovarian superovulation, and once ovarian superovulation is done, of course, timing can be made for someone to conceive. If that method is not possible, for you, then you are going to use a donor egg during IVF. If ovarian superovulation is not possible, or maybe it has been done several times and you're not able to conceive, or if it's not possible wherever you are, then you're going to go for an IVF. You need a donor egg. But also, they say prevention is better than a cure. Now, I am talking about, I'm talking to women who are still in their 30s. You stopped conception, you're still in your 30s. You're advised to keep your egg. There is what we call fertility preservation. Fertility preservation is a process whereby the egg, your ovum, can be harvested, can be removed from the ovary and kept in the fridge, in the freezer somewhere. It can be kept in the laboratory. It can be kept in the hospital, safe. So just in case you reach menopause and you still want to produce, to conceive, you get your egg. Just in case you get poor or low ovarian reserve, diminished ovarian reserve, you can go to the hospital and tell them to give you what belongs to you. So fertility preservation is also key, and it is applicable these days. Now, finally, as we are answering this, a woman of 42 years can be able to conceive. Yes, you can conceive. 45 years, yes, you can conceive at 45. 50 years, yes. 60 years, yes. How? Number one, if you're still having menstruation, that is easy. If you're still having menstruation, that is easy. We just do a fertility screen and find which hormone is maybe lagging behind somewhere, or where is the problem, whatever the problem may be, we identify it, you can conceive. That is for a woman who is still undergoing menstruation. A woman who is no longer having a menstruation is the one that will require what we've called ovarian superovulation. If you've not yet subscribed to my YouTube channel, what are you waiting for? Also press the notification bell in order to be notified of any important video we upload. And I told you, for those who would like to have a private chat, a private conversation, go to my website www.druthman.com. It's now active. We received it very well. You can ask your questions. I'll be there to answer you. And you can also find me on all social media platforms. The name is Ask Dr. Uthuman. Sign out.
Ask Dr. Uthuman on Sawa World.